Kristen Walsh knows firsthand what it's like not to have a family doctor. She's struggling to manage polycystic kidney disease, a rare type of arthritis, and ADHD, all without a family doctor. It means she's paying out of pocket to see a nurse practitioner a few times a month, costing $70 a visit.
I had a lot of edema, like leg swelling, so I was going like almost every week. And every visit is a subsequent cost, so it can get very costly, and it's also not covered by private insurance.
When you're sick, a doctor's office like this one is normally the first place you call. But 6.5 million Canadians don't have access to primary care. A new report from Health Canada estimates 23,000 family doctors are needed to fill the gap. And over the next 5 to 10 years, that number could grow. Ting-Ting Zhang is a researcher with the C.D. Howe Institute. She studies how the provinces are handling the doctor shortage.
It has been a challenge for decades for these provinces. So many of them are working on multiple strategies.
Strategies like reducing the administrative burden, expanding the scope of practice for other healthcare professionals, new payment models, and finding more and faster routes to practice for internationally trained physicians. Which brings us first to Nova Scotia. There are thousands of internationally trained doctors looking for a path to practice in Canada. Nova Scotia is launching a new way to get some of those doctors seeing patients.
What we're trying to do here is to develop a better, quicker, reliable, safe way to identify competent physicians.
Instead of relying on exams, the province is setting up a physician assessment centre of excellence, first of its kind. Doctors already practicing in Nova Scotia are training to assess doctors trained abroad. Dr. Gus Grant says it will drastically cut the time needed to get internationally trained doctors working from 18 months down to about 12 weeks. The clinic will also see people without primary care. When fully functioning, it could add up to 40 doctors to the system every year.
We want to open the door as wide as possible to as many candidates as possible without lowering the bar of the necessary competences required to be demonstrated.
Dr. Andrea McCauley lives this care crisis daily, and it's why she signed up to assess internationally trained doctors.
I have been shocked over the years to realize how many good, capable, competent, fully trained physicians don't have a pathway to licensure in our province. I hope that the work being done in Nova Scotia can be replicated other places.
It may not be that easy, coast to coast to coast. Each approach is as unique as the terrain. The Yukon is taking steps to establish a new homegrown residency program. It could open as soon as 2027. Dr. Derek Bryant is the president of the Yukon Medical Association.
Essentially, the hope is that we would have the ability to train family doctors locally here, because currently there is no option to do that.
Dr. Bryant hopes young doctors will put down roots and stay. According to a recent survey, the Territory's Medical Association expects 40% of doctors there will leave or retire in the next 5 years. About 4,000 people are waiting for a primary care provider in Whitehorse alone. And as Yukon's population grows, a bad situation could get worse. To the south, the scenery certainly doesn't hurt. But British Columbia needs more than that to boost recruitment and retention.
This payment model for family doctors will help protect and strengthen BC's healthcare system by helping to attract new family doctors and retain existing doctors.
A new compensation model was launched in 2023 to bump family doctor pay from $250,000 up to $385,000. Rather than the old fee-for-service model, doctors are now compensated for time spent on admin work, charting their clinic load and the complexity of their patients.
Come on in.
The province says it's brought on 1,000 new family doctors since then. It's an investment Dr. Rita McCracken says can make Canadians healthier in the long run.
We have a mountain of evidence that tells us that primary care is the most important investment that we should be making in the health of Canadians. We know that primary care makes people live longer, and it also saves the system money overall.
McCracken, a physician and primary care researcher, says this new pay model is a start, but now is not the time to let up. She says the province must now focus on the number of clinics, not just doctors, improve its delivery of team-based care with other highly trained health workers to triage who needs to be seen fastest and first, which could connect more patients with doctors.
I think we need to be ready to try new things, measure them, keep the ones that are working, and drop the ones that are not.
That is the one common approach to finding a cure to the crisis in Canada. The provinces and territories are trying and learning, but for the people who need care right now, the cure can't come fast enough. Meanwhile, Walsh, who's been waiting to be connected with a family doctor for years now, says she wishes this was a problem that was solved yesterday.
We're seeing people slip through the cracks every day that are not able to navigate their health without a doctor.